So next is continuation. We'll start with clubbing of fingers. So already I have told regarding clubbing of fingers, isn't it? So this is a figure of a nail, that is clubbing of fingers. Already I told clubbing doesn't mean that it is attached. Okay, clubbing of finger is a condition in which the finger tips becomes bulbous. Okay, normally the finger tip is there, it becomes like a bulb shape. Okay, so I told that normally what happens is the normal angle of the nail bed, it has to be how much? It has to be around 160 degree. Okay, but in the case of clubbing of fingers, what happens is the angle of the nail bed will increase more than 165 degree, and it can become up till 180 degree also. Okay, so that is referred as the angle of clubbing of fingers. It will be more than 165 degree. Okay, this is one more figure in which the patient is having clubbing of fingers. Okay, you can see that the distal end of the fingers, it is bulbous. Okay, now this figure also I think I might have already showed you. This is a normal angle of the nail bed, which is 160. While here what happens is it becomes more than 160. Okay, this is clubbing of fingers. Now we'll move on to the definition of clubbing of fingers. Okay. Now clubbing of fingers means the distal end of the fingertips, it becomes bulbous. Why it becomes bulbous? Why there is clubbing of fingers? That also I already told. It is mostly because of chronic hypoxia conditions. Okay, what happens in hypoxia? There is decreased oxygen. Okay, decreased perfusion is there. So what happens is there can be vasodilation, and that will increase the capillary permeability, and that will result in interstitial edema. So your finger nails or fingertips are becoming edematous like a bulb. Okay, why it happens? It is because of poor oxygenation or hypoxia. And commonly this clubbing of fingers is seen in all the almost all cardiac conditions. Okay, like cardiac conditions, when I see say most of the time patients not only with the cardiac conditions, even with your uh, COPD, chronic obstructive pulmonary disease conditions, or chronic asthmatic patients, most of the time COPD patients itself, along with that heart patients, they usually tend to have a clubbing of fingers. And even patients with cirrhosis of liver, because of poor oxygenation, they too tend to have clubbing of fingers. Okay, and this clubbing of fingers is also referred by many other names, like it is also called as drumstick fingers or watch glass nails. It is called as drumstick fingers or watch glass nails. That is the other name. Now the procedure that we do to assess the clubbing of fingernails, that is called as Shamroth window test. Okay, the procedure that we do to assess the clubbing of fingernails, that is called as Shamroth window test. Now what you are doing to assess the Shamroth window test, already I have told you. You have to hold your fingertips. Okay, what you have to do is you have to bring the fingertip of the patient to the eye level. Okay, like this. Okay, you have to bring the fingertip at your eye level. Okay, normally you can see that there is a small space that is diamond shape. Okay, when you bring your fingertip to the eye level, okay, normally you should see there will be a diamond shape, small, very small diamond shape will be there normally. Okay, that is normal. This one, this is a figure. Okay, this is a normal one, but when you are not able to see that, that will refer as clubbing of fingers. Okay, it is not a very big space, like it is very tiny. Okay, so you can keep your fingers in this manner, and please do check. Okay, not that you are having clubbing of fingers, because you should know how to assess for clubbing of fingers. Okay, so normally what you will see a diamond shape. Okay, but in abnormal cases, if you don't see the diamond shape, what does it mean? It means that there is clubbing of fingers. Okay, so already I told normally the angle is 160 degree, but in clubbed fingers it is more than 165. Okay, 180 is maximum here, but 165 only will tell that it is abnormal. Okay, so that is about the clubbing of fingers. Some other type of abnormalities may also be seen in your nails, okay, like spoon shaped nails, or we have got paronychia, then pitting type of nails and all. Okay, we'll see that. Now, Koilonychia means spoon shaped nails. You can see the nails are somewhat spoon shaped, abnormal shape. Paronychia means there is infection in your nails. It is very common, isn't it? Most of the time agriculturists and all, they will get this infection in their nails. Okay, then some other abnormalities are there that is related to the condition like endocarditis, then even in rheumatic heart disease and all, they will see some abnormalities like this is osler node, janeway lesions, okay, petechiae, okay, all these abnormalities will be seen, splinter hemorrhage. Okay, you will see in detail in this disease conditions. Okay, you need not worry about what it is, this is just the figure. Okay, and even Roth's spot, that is retinal hemorrhage, these and all are some abnormalities you will see in some cardiac conditions. So carefully you have to assess the patient. Next is regarding cyanosis. Cyanosis means bluish discoloration of the skin and mucous membrane. Now, why cyanosis is observed? It is because of poor perfusion or poor blood circulation. What happens when your hands, your feet, and all will receive poor perfusion? They tend to become bluish. Okay. Commonly, the cyanosis can be seen in your fingernails or toenails, even around your mouth, especially the cheek, lips, your nose, and ears. Okay. In children and all, commonly you can see it. So that is why cyanosis is divided into two types. Okay, cyanosis is divided into two types, that is central cyanosis and peripheral cyanosis. So as the name suggests, central cyanosis means what? Cyanosis in the lips or around the mouth or tongue, that is called as central cyanosis. Okay, so your lip or tongue will become bluish, that is called as central cyanosis. Peripheral cyanosis means bluish discoloration in the periphery, especially your hands and legs. Okay, that is called as peripheral cyanosis. Now most of the time when a person is having cyanosis, you should also check for capillary refill. Okay, capillary refill will be normally it is less than 2 seconds, but here what happens, it can be more than 2 seconds, which is completely abnormal. This is again an example. Okay, this is an example of central cyanosis, this is an example of peripheral cyanosis. Next, how to check for capillary refill. Okay, this also already I have explained. I need not tell you again. You have to hold your fingertip and you have to press the fingertip at least for few seconds. It will blanch. Okay, then slowly release. It will become pink. Okay. So normally it has to return within 2 seconds. It is very important, students. Please, you should know how to do the capillary refill test. Okay. So once the pressure is released, the pink appearance will return back, or blood circulation will return back normally within 2 seconds. Okay. Next is a very important assessment, that is skin turgor or skin elasticity. Okay. Now skin turgor or skin elasticity, for that you have to pinch with your thumb as well as your index finger. You have to pinch the skin. That does not mean everywhere you will pinch the patient. There are some sites to assess the skin turgor. Okay. The sites are glabellar region here. Okay. Here also you can do test. Upper chest, especially below the clavicle, also you can do the test, or you can do in the abdomen near your umbilicus, especially for children we will do that, and forearm. Okay, in your forearm also you can test for skin turgor or skin elasticity. Now why you are doing skin elasticity test? To check if there is dehydration. Okay, children, you should note that whenever there is dehydration, maybe because of excessive diarrhea or electrolyte imbalance or vomiting and all, the skin turgor will reduce, isn't it? So normally, when you are pinching the skin, normally when you pinch the skin and immediately it will come down. Okay, immediately when you are pinching and releasing, it will come down immediately. But when a person is dehydrated, what will happen? It will come back very slowly. Now it is not applicable for elderly people. Okay, elderly people who are very old, their skin elasticity is only low. If you do on them, it obviously the skin will come very, very slowly. Okay, so that is not applicable here. Okay, you have to pinch the patient with the thumb as well as your index finger, okay, for 3-4 seconds, and then release back. Immediately the skin has to come down within 2 to 3 seconds. Okay, if it remains there only, it means that the person's skin turgor is reduced because of maybe vomiting and all. Next is regarding the edema. Here you can see the figure of edema. This is an example of peripheral edema. That is edema of the periphery, that is your extremities. Okay, now you know why edema occurs. Already I have told, accumulation of or water retention, isn't it? That will result in edema. What are the different types of edema? Already you have studied, I guess. Generalized edema, localized edema is there, pitting edema, non-pitting edema, peripheral edema. First of all, generalized edema. Now, generalized edema could be most of the time water retention in different body parts. It could be in your entire body parts like your abdomen, around the eyes, legs, the face, feet, everywhere. Edema is there. What you tell it, it is called as anasarca. That already I have showed you the figure. Localized edema means only edema is there in one organ. Okay, any one body part, if edema is there, we call it as localized. That is local. Okay. Pitting edema, this also already I told you. Pitting edema means what you have to do? You are applying pressure with your finger. Suppose your edema is there, you are applying pressure here for some time. Then even after you remove the finger, if there is an indentation, means mark is there. Okay, like a pit, if it forms an indentation, that will show that person is having pitting edema. Okay, non-pitting edema means even when your edema is there, if you press and no mark is seen, then it is called as non-pitting edema, where there is no indentation. Even when your edema is there, you press for so much time, no mark is seen, that is called non-pitting edema. Okay, next is peripheral edema. Peripheral edema, I told, legs, extremities, if you see the edema, that is called as peripheral edema. Okay, so as I told, what is the procedure for doing checking for edema? You should use your thumb or you can also use your finger. Okay, and you should press. Okay, you have to press it. For example, if it is in the extremity, you can press it here near the medial malleolus. Okay, after pressing for some time, you will see that there is indentation, mark is there, that is called as pitting edema. Now there is some grading. Okay, the grading is this one. You can use a scale to check for the grading. Okay, this is a grading. So suppose 2 millimeter with the scale, when you are measuring, if you get 2 mm, okay, that means 1 plus grading. If it is 4 mm is there, that much big is there when you are measuring with your scale, if it is 4 mm, okay, then it is called as 2 plus grading. And usually the skin will come back very slowly. Okay, then 3 plus means usually what will be the, in 3 plus grading means in the scale you will get 6 mm deep. Even you're pressing 6 mm deep is there, then it is 3 plus grading, and the skin comes very, very slowly. That is 10 to 12 seconds it will take to come back to the normal this one. Okay, next is when you're pressing and if it is going 8 millimeter deep, okay, and it is coming back after 20 to 30 seconds, then it is 4 plus grading. Okay, so this is the grading. You will just have to learn this table. Okay, remember the table. You will have to actually do the indentation, and then you will have to measure how much deep it has gone. Okay, so this is 2 mm, this is 4 mm. Okay, then again it has gone 6 mm, that much you have to measure. Okay, 8 mm. Next is observing the chest is very important here in case of cardiovascular conditions. Okay, see, for different type of chest, we have, you might have studied in foundations itself, isn't it? Caved in type of chest is there. Then you have also got protruded type of chest. I'll show you the figures here. Okay, so this is a caved in chest which is called as pectus excavatum. Okay, pectus excavatum means caved in chest. Because it is in this shape, caved in, it is also called as a funnel shaped chest. So this abnormality you should check if it is there in your patient. Okay. Next is pectus carinatum. Now pectus carinatum is like a protruded type of chest wall. Here it is also referred as pigeon chest. Okay, because of this particular shape, the name has come as pigeon chest. Next is now regarding assessing the blood pressure or the pulse. Now, whenever you're checking the BP, you should check the BP both arms, both right as well as left side. You have to check, and even pulse also. Not only checking in right side, check it in the left side also, because most of the time, patients with cardiac conditions tend to have differences. Okay, they can have lot of changes in their BP or pulse and all. Okay, and also compare the systolic and diastolic blood pressure. You know the normal blood pressure is 120 by 80 mm of Hg. 120 is the systolic and diastolic is how much? 80 mm, isn't it? Okay, now there is one more new term that you are supposed to learn, that is referred as pulse pressure. Pulse pressure means it is the difference between the systolic and diastolic. Okay, again I repeat, pulse pressure means it is a difference between systolic BP and diastolic BP. Normally, what is the normal pulse pressure? Normal BP is 120 and diastolic is 80, isn't it? So if you are 120 minus 80, how much it comes? 40, isn't it? So 40 mm is a normal pulse pressure here. Okay, and that is a normal pulse pressure. But there is one more condition that is called as pulsus paradoxus. Okay, pulsus paradoxus, which is also referred as paradoxical pulse. Okay, so pulsus paradoxus or paradoxical pulse is an abnormal condition where there is decrease in the systolic blood pressure. Okay, the systolic blood pressure will be more than how much? 10 mm. It will decrease more than 10 mm during the inspiration. You know what is inspiration, isn't it? Inspiration means taking in, breathing in. So when you're breathing in and breathing out only, what happens? Your blood pressure, systolic BP is reducing. You can imagine how much fluctuation is there in the blood pressure. So that is a term which is called as pulsus paradoxus. Okay. So pulsus paradoxus is a condition in which there is decrease in the systolic BP till how much? 10 mm during the inspiration. And when it is seen, this pulsus paradoxus is commonly seen during pericarditis, and also it is seen during pericardial tamponade. We'll discuss regarding these conditions in detail. Next is the various methods or various sites where you can check for the pulse. It is a very important topic because most of the time examiners ask you. They may just tell, assess the different sites of pulse. Now already you have studied in your first year in foundations. Okay. Now arterial as well as your pulse, you are using the same sites. Carotid. Okay. Then you are knowing about your brachial. You have got your radial as well as your ulnar. Then you have got your femoral in the thigh region, popliteal behind your knees. Then in your ankle region, you have got posterior tibial and dorsalis pedis. This you should know exactly. They will ask you to show and they will ask you to name the site of pulse. Okay, so that is an important topic there. So we have finished regarding inspection. Next is moving on to palpation. Okay, so when you are doing the palpation, remember you are using your finger pads rather than using the palm, isn't it? You use your finger pads, okay, for checking the palpation. So normally, what is a normal finding? I told you when you are doing the palpation, what you have to do is you have to go for the point of maximum impulse. Where is your point of maximum impulse? The point of maximum impulse is in your left side. Okay, in your mid clavicle, that is your clavicle. When you see your middle, if you are drawing an imaginary line, that is called as a mid clavicle. Okay, so in the mid clavicular region, if you go downwards in your fifth intercostal space, okay, you will see the point of maximum impulse. Okay, there you will get the highest point where your heart is beating. Okay, that is called as point of maximum impulse. Okay, so PMI means point of maximum impulse, ICS means intercostal space. Okay, MCL means mid clavicular line. Okay, so that is a point of maximum impulse. Anyone can ask you, Point of maximum impulse will be always in the left side, mid-clavicular region in the fifth intercostal space. Normally, there should not be any edema, there should not be any thrills or heaves. Okay, regarding thrills or heaves and all, we will discuss it. It is the type of murmur, okay, abnormal heart sounds. Okay, so this is a normal finding. You should not feel any abnormal heart sounds. Okay, see, you can see that here the doctor is examining the point of maximum impulse. So already I told you this is a clavicle. If you see an imaginary line in the mid clavicle, this one is your mid clavicle. This is a point of maximum impulse. Normally you can feel it. You can just place your hand and you can feel it. Okay, again I have just mentioned about the point of maximum impulse. There is nothing more than that. Okay, it is in the left side in the fifth intercostal space in the middle of your mid clavicular line. Okay, and this PMI or point of maximum impulse is also called as apical impulse. Okay, in your care plans and all might have written apical pulse. Apical pulse, how much it is. Okay, apical pulse means what now? Apical pulse means when you're putting your stethoscope and auscultating for the heart rate or heart sound, how much beats you will get? That is a apical pulse. Okay, or point of maximum impulse. Other than checking or palpating for the pulses, you should also palpate and see the extremities, both the upper and lower extremity. Now, why you are doing the palpation? As I told, to see the temperature, whether it is cold or clammy or warm, see for the moisture or see for dehydration. Then seeing the pulses also. You should palpate for the pulses. I have mentioned both the left hand, right hand, you should palpate the pulse. Okay. Next is seeing the edema. Okay, if edema is there, you should see what type of edema also. Next is you can also palpate and see for the pulses in your neck, isn't it? That also can be done. And also when you're checking the pulses anywhere in your body, you should see for the rhythm. Most of the time, normally it will be regular. Okay, one pulse will come after the other pulse. Regularly it will come. But patients with cardiac conditions, their pulse will be irregular. Okay, it will come once, then after some time, some other irregularity it will come. Okay, that can be noted sometimes. And always remember to do right side also, left side also. Okay, both you have to perform. Common sites of palpating arteries, same site. Already I have mentioned it. Next is you should also see for the rigidity of the blood vessel. Whenever you are palpating the blood vessel, see for the hardness or rigidity. Okay, just feel for any of your arteries or pulses and all, and then you have to feel for the hardness. Okay, next is inspect and palpate for pulsations. Okay, now pulsations, these are more visible when the person is thin, and pulsations are abnormalities. Okay, they will show that there is increased pressure or increase in the volume. How will you do it? You have to just place your hand here in the point of maximum impulse or apical pulse. You will feel the pulsations. Okay, normally you will not feel it. In abnormal conditions only you will feel. Okay, that is called as pulsations. Next term that I am going to discuss here is lift or heave. Okay, lift or heave. Now lift or heaves are these are some cardiac contractions. Okay, because and there will be some vigorous movement in the rib or in the sternum. That is called as lift or heave. So remember, lift or heaves are not at all normal. It is abnormal. Now these things and all are only detected by cardiologists. All right, nurses are not doing these things. Okay. So, but you should know the theoretical part of all this. What is a thrill? What is a heave? What is pulsations? These all terms you should be knowing it. All right. So, lift or heave is some cardiac contraction. Okay, that is there is some vigorous movement in your sternum or rib. Okay, that is called as a lift or heave. Now, why do you see that? It is mainly because of right ventricular enlargement. Okay, when there is right ventricular failure, commonly you will see or find out lift or heaves. Next, one more important term or one more important abnormality that you see is thrill. Okay, now thrill means vibration. Now, normally, if you just place your hand on a sound system, what happens? You will feel the vibration, isn't it? So, similarly, you can feel the vibration in the chest wall. That is called as a thrill. Again, remember, thrill is not normal. Okay, thrill is not normal. In abnormal conditions only you will see the thrills. When you are keeping your hand in the region, okay, you will feel like there is a thrill. Okay, when you keep your hands in the fistula, have you observed, you will feel that there is some vibration. Okay, similarly here also you will feel that vibration. Now why you feel the thrill is mainly because of the gushing of the blood or increased pressure or volume. You will mainly feel the thrill. The next term that we are going to see is bruit. Okay, now an artery that is narrowed, okay, what will happen when the any pipe, or when if you consider a pipe, if it is very narrowed and the blood is flowing through, water is going through that pipe, okay, what will happen? Narrow pipe means most of the time the water flow is very much in high speed, isn't it? Turbulence will be high. So similarly here, when there is narrowing or bulging, okay, sorry, when there is narrowing of the artery, what will happen? There is increased flow of the blood there. Okay, so that will create one buzzing or humming like. That buzzing or humming like is called as a bruit. Okay, remember that. That is a term. Okay, so always you have to again remember that we have got the stethoscope, we have got the bell as well as the diaphragm part, isn't it? All are aware the stethoscope is having bell and diaphragm. Now the bell part which is there in the stethoscope, that is used to listen to the low pitched sound. Okay, bell is used to listen to low pitched sound, while the diaphragm we are using to listen to the high pitched sounds of the heart. Okay, that much you have to remember. Both we use, bell as well as a diaphragm we use to auscultate. Okay, next is moving on to the chest percussion. Okay, now chest percussion is very much limited here. We have not much, there is nothing much to discuss in this chest percussion. All right. Okay, only thing is you will feel that there is a dullness you have to see, or you will see for the resonance in the region where there is lungs, isn't it? You might have already studied about the assessment in the respiratory system. When you are when you are percussing the chest, especially in the lungs part, you will listen for resonance. In abnormality, hyper resonance and other things will be there, or dullness will be there, isn't it? So just you can percuss and you can check. Next is auscultation. Now auscultation, you are using the stethoscope, both the bell and the diaphragm. Okay, so already I told, bell you should use for low pitched sound and diaphragm you have to use for the high pitched sound. Normally auscultation you will listen for the normal heart sounds. Which are the normal heart sounds? S1 and S2. Okay, and what is the normal heart rate? It has to be in between 60 to 100. Okay, in between 60 to 100 is a normal range. Okay, normal heart sound is S1 and S2. Which are the abnormal heart sounds? There are so many abnormal heart sounds that we will see in detail. Okay, so normally you should not hear any abnormal heart sounds. Now, what is a normal heart sound? S1, S2. What is the S1? We'll see some theory part. Okay, S1 means first heart sound. Why do you hear the S1? Why do you hear the S1? S1 signals the beginning of systole. Always remember, S1 signals beginning of systole. And why do you hear it? Because of the closure of the AV valve. Okay, because of the closure of AV valve, which is at tricuspid and mitral valve. And it is also referred as lub. Okay. Next one is S2. S2 is also called as second heart sound. These are the normal heart sounds. Okay. So S2, when you hear it, beginning of the diastole. Okay, and why you hear? Because of the closure of the semilunar valve, that is your aortic and pulmonic valve, and it is referred as dub. Now if your examiner asks you what is a normal heart sound, don't tell lub and dub, you should tell S1 and S2. Okay, S1 is a normal heart sound, S2 also is a normal heart sound. Okay, so S1 is beginning of systole, S2 is beginning of diastole. S1 is because of closure of AV valve and S2 is because of the closure of the semilunar valve. And S1 is referred as a lub, S2 is referred as a dub. Okay. So the nurse can auscultate and they can use the diaphragm as well as a bell. Already I have told about it. Okay, this also already I have told. The diaphragm you can use for the high pitched sound. Okay, and bell you are using for the low pitched sound. Okay, now where and all you will keep the steth? Before going into the abnormal heart sounds, I will tell you where and all you should keep your stethoscope. Okay, just this is a theory part. All right, you need not. I don't think anyone will ask you regarding all this. Okay, but you should know what are these. When you are doing the cardiac assessment, okay, we have got aortic area, pulmonic area, tricuspid area, mitral area, and Erb's point. Okay, so here it is already there in the figure. All right, so this is the aortic area, pulmonic area, Erb's point, tricuspid, and mitral area. Now mitral area is called as apex, apical pulse, or point of maximum impulse. Already I told, isn't it? Where is a apical pulse or where is a point of maximum impulse? That is in the left side in the fifth intercostal space. Already I have told. That is a mitral area. Okay, I think then this is familiar for you. Okay, remaining things we will see. In the right side, we have got aortic area, that is the second intercostal space. Okay, right side, second intercostal space, that is in the mid clavicle itself. Okay, we have got aortic area. Opposite, that is just symmetry of that, we have got pulmonic area. Pulmonic area is in the left side, second intercostal space. Okay, in the third intercostal space, okay, in the third intercostal space, again in the left side itself, we have got Erb's point. Okay, next is in the fourth or fifth intercostal space, nearby itself, we have got tricuspid. Okay, then which is the mitral area? Mitral area or apical pulse or point of maximum impulse means where? In the left side in the fifth intercostal space. Okay, that is regarding the auscultatory areas. Means you can keep your stethoscope in all these areas and listen to the normal heart sound, or you can also auscultate for abnormal heart sound. Remember, aortic area is only one which is in the right side, remaining all are in the left side. And the main thing you have, if you forget anything also, remember only about apical pulse. Apical pulse means it is a point of maximum impulse or the mitral area. It is seen in the where mid clavicular left. If you draw an imaginary line and go down, you will see the fifth intercostal space in the left side. That is the apical pulse. Same thing. Okay. So here also you can see the same figure. This is just see, this is a mid clavicular line, an imaginary line you are drawing here. Okay. Aortic area is there, pulmonic area, tricuspid area. Okay, we have got mitral area. Okay, and this is just the anterior axillary line. Okay, if you go this side, you will get the mid axillary line. Okay, you will study that in your ECG. This is your sternum. Again, how you can remember? Ape to man, you can remember by that term. Okay, ape, AP. A means refers to aortic, P means pulmonic, T refers to tricuspid, M refers to mitral. Okay, so this is a mnemonic which you can use to remember the sites of cardiac auscultation. All right, ape to man. AP. A means aortic area, P pulmonic area, T tricuspid area, M main important one, that is mitral area or point of maximum impulse, or also called as apical pulse. Okay, so this is regarding the normal things. Abnormal heart sounds also we will move on later.